Samantha Batty, NHS Health Check for Leeds GP Confederation. This is a short demonstration for all clinicians completing a risk assessment and risk management following an NHS Health Check completed within the community. This is for EMIS practices, so any System 1 users, please refer to a separate video. This is the test patient, and before completing the NHS Health Check Q risk, I'm going to be making sure that their results are back, that they're within normal values. Any elevated values or suspected familial hypercholesterolemia or elevated triglycerides, elevated HbA1c, then I'm going to make sure that that follow-up is completed before proceeding to complete the health check. If I'm happy that all the values are within range and any other results are not outstanding, such as home blood pressure readings, then I'm going to open the template for the NHS Health Check Community Programme. You'll find that through the search, and there's two templates available, but the NHS Health Check Community Programme is the one that we want, ensuring that the correct codes are available. All of these tabs will have been completed within the information gathering section, so it's just a QRIS that we're going to go down to at this point. Now, EMIS have swapped over to the QRIS 3. Any of these values here will be populated automatically if they've been previously coded in the patient's records. However, they don't form part of the NHS Health Check questions, and therefore assessment and diagnosis is not mandatory and definitely not a requirement of the clinicians completing the health check. To calculate the risk assessment now, it will open to an external browser through selecting the link. And you'll need to manually input all of the information all the way through, making sure that it is accurate throughout. Any omissions or inaccuracies may result in different pathway for the patient, especially when they're close to the 10%, 20% mark. So you can see this patient scores a risk score of 0.6%. And now we've captured that information and calculated. We're just going to go back to the template and populate that information in here. Once populated, we're going to proceed to the risk score and recall. And there is some information here between 10 and 20%. The dummy patient that we scored was under 10%, and therefore we're going to proceed to record the diagnosis, risk score of primary prevention of cardiovascular disease and supersede the recall to 5 years. We're then going to scroll down to the bottom and ensure that both codes are selected, both NHS Health Check completed and NHS Health Check completed by third party. By selecting both these codes, the diagnosis code, and ensuring that the Q risk is saved to the record, this will ensure appropriate follow-up is made for the patient for formal invitations for public health searches and also payment for practice. If a patient scores between 10 and 20%, then you're going to return to the information gathered within the Part 1 NHS Health Check and discuss any areas for modifiable risk for the patient. Where that's been ineffective, we can continue to discuss statins and the appropriateness for them. We can select offer of statin therapy if we proceeded to that. The outcome of the statin conversation can be documented here, particularly if they've declined a statin. If they have declined a statin, we do want to know why they've declined it. So once they've provided that informed assent, then that can be added as a consultation. And that information will help public health to address barriers citywide, but also follow up conversations for clinicians moving forward. So if the patient is between 10 and 20%, you've discussed modifiable risk factors, you've offered a statin, and they've provided that informed assent. You've selected statin declined here, and you've added the consultation afterwards of why they've declined. You're going to proceed to NHS health check completed, NHS completed through third party, but a patient declining a statin between 10 and 20 will still fall eligible for a 5-year NHS health check, in which case you're going to select primary prevention and then again supersede the recall for 5 years' time. If the patient, however, starts a statin, you're going to select high risk of cardiovascular disease and then set an annual recall. Again, selecting both NHS health check completed and NHS health check completed by third party. If a patient scores over 20%, then you will again proceed to offer a statin and then record the outcome as appropriate. However, they will no longer be eligible for an NHS health check, so the diagnosis code is always going to be at risk of cardiovascular disease and an annual recall will be set. Again, you scroll down to the bottom, ensuring that both tick boxes are selected, NHS health check completed and NHS health check completed by third party. It's important to note that all NHS health check that are completed, best practice recommend only a cholesterol blood test as a full lipid profile. If the blood pressure is elevated, a kidney blood test, and if they are known to be pre-diabetic or their assessment indicates an increased risk of diabetes, will a HbA1c be obtained. So at this point, if they are starting a statin, then you will continue to arrange the appointment for baseline liver function test and also secondary causes of elevated cholesterol, whether that be HbA1c or thyroid. The follow-up messages from here, or follow-up tabs from here, is a referral, patient results and feedback, and admin and guidance. For System 1, the results letter can be populated through documents, adding a document, creating a letter, and then finding it through the NHS health check. And that will be sent out however your practice communicates that back to patients, along with the outcome of their risk assessment recall, whether that be annual or 5-year. Going back to the template, the last page provides some contact details, so should you have any further questions, you can contact us directly, either through your practice manager that will have the contact details or directly through the Leeds GP Confederation email here. Thank you.